Chapter 16, Nutritional Aspects of Pregnancy and Breastfeeding, Screencast 5. In the previous screencast, we introduced a number of nutrition-related factors that impact pregnancy outcome. This screencast is focusing on those in a much greater detail. The first is age at which pregnancy occurs. Physical maturation occurs for 5 years after menarche. Women younger than 18 are not as physically ready to be pregnant. Teen years are a period of time in which high nutrient needs, and it's known teens frequently consume inadequate amounts of nutrients. If they can't support their own nutritional needs, it's going to be very difficult for them to support the needs of a developing fetus. Another issue is they may not get adequate prenatal care. What we do know, babies born to teens are at greater risk for premature birth, prenatal growth retardation, and death soon after birth. Another important factor to keep in mind is making sure that the woman is eating regular meals. It's important to have regular meals to avoid the development of ketone bodies. Ketone bodies are poorly used by the fetal brain and also will slow the development of the fetal brain itself. One population in particular that has to be careful are going to be vegans. They need to make sure that they're getting enough protein, vitamin D, vitamin B6, iron, calcium, zinc, and B12. Another factor may be how many times has the woman been pregnant. Numerous pregnancies and/or pregnancies that are closely spaced are going to deplete a woman's nutrient stores. Another factor would be multiple fetuses. Carrying more than one fetus is going to increase nutrient and calorie needs. Inadequate, delayed, or absent prenatal care can deprive the fetus of nutrients. Also, if there's untreated chronic diseases such as heart disease and other underlying diseases, will increase the risk of fetal damage. If we look at women that have HIV or AIDS, they are going to have increased needs for energy, also some vitamins and minerals. Pregnancy-induced hypertension. This is going to impair the delivery of oxygen and nutrients to the developing fetus. This can actually retard growth and cause premature birth. It can also escalate into preeclampsia and eclampsia. Preeclampsia, some symptoms that might be experienced are going to be high blood pressure, finding protein in the urine, headaches, blurry vision, changes in blood clotting patterns, nervous system disorders, or development of swelling and edema. Eclampsia, much more serious, resulting in maternal convulsions, coma, and actual death of the mother and fetus. One disease in particular that will impact pregnancy outcomes is going to be type 1 and type 2 diabetes. It is very important that women that are diabetic have good glucose control. Those that do not have good glucose control increase the risk of poor pregnancy outcomes. Some women will actually develop diabetes during pregnancy, and that's known as gestational diabetes, and that can actually develop in up to 9% of all pregnancies. Exercise and diet can help control diabetes. Concerns with the pregnant diabetic are going to be the depletion of fetal iron stores, large for gestational age infant, low infant blood glucose levels at birth, preterm delivery, an increased risk of birth trauma and malformations, a higher risk of the mother developing type 2 diabetes in the future, and also a higher risk of the infant developing type 2 diabetes and obesity later in life. Now, there are a number of socioeconomic issues that are of concern. Women that have limited income, education, and social support tend to have inadequate diets, and there are a number of programs such as SNAP and WIC where pregnant women can turn to get help for these conditions. Now, there are also some compounds in foods that should be limited during pregnancy. Examples are going to be environmental contaminants, caffeine, foodborne pathogens, and food additives. Now, we also know that there are a number of substances that can harm the developing fetus, and these need to be avoided. Those include alcohol, drugs, herbals and botanicals, and smoking. Now, there are a number of concerns that we want to address along the way. During pregnancy, women are experiencing both physical and hormonal changes that can affect a pregnant woman's body after the egg is fertilized. Some of these could be heartburn, constipation, nausea and vomiting, and edema. Heartburn can result from the expanding uterus, crowding and compressing abdominal organs. Hormones may actually slow the speed of digestion and relaxing the sphincters. This can be treated with small meals, avoiding foods that are spicy and fatty, limiting the intake of caffeine and chocolate, avoid lying down after eating, and also antacids. Constipation can result from hormones that relax intestinal muscles and slow down digestion, and this is going to mean more water is going to be reabsorbed, resulting in compression of the GI tract by developing fetus. This can be treated with having a diet high in fiber, 28 grams per day, increasing the intake of fluids up to 10 cups per day, and exercise. Nausea and vomiting may be due to pregnancy-related hormones or iron in supplements, normally called morning sickness. This can be treated with breathing cool, fresh air, avoiding odors that are offensive, large fluid intakes, and an empty stomach, and also eating foods that ease these symptoms. Edema can be caused by a number of things, such as placental hormones, an increase in blood volume, and also compression on blood vessel in the legs. Special concern when found in lower legs and accompanied by high blood pressure, protein in urine, failure of edema to subside when feet are elevated.